It's great that we teach officers how to defend themselves and how to use their weapons properly, but we also have to teach them how to debrief from those incidents when they do occur.
Most first responders can tell you about a case or scene they'll never forget.
It's a lot of looking in people's eyes and just seeing the hurt.
Witnessing a young lady that I used to mentor was shot and killed.
Christmas Eve 2 years ago, we had 5 people shot.
It's a blessing and a curse. They can help us during our worst day, but our worst day is their everyday at work.
The stuff they see in their job affects their lives completely differently than an office worker who has a 9-to-5 job.
According to the CDC, suicide rates climbed for years before a 3% drop from 2019 to 2020. Yet that same rate among police officers and firefighters hasn't declined. Ruderman Family Foundation published research showing officers and firefighters are more likely to die by suicide than in the line of duty.
I'm getting a notification every day of a firefighter or a police officer, somebody that has committed suicide.
So departments are working to flip the script. Charlotte Fire and the Mecklenburg County Sheriff's Office have hired mental health professionals in the last few months.
I'll also do crisis management work, whether that be going out to stations after a bad call or going on scene after some very traumatic call or incident that they may be on.
Dr. Kareem Paranda is a former police officer, now counseling deputies.
Being able to detach from emotions is one of the ways that law enforcement officers and firefighters are able to do the job effectively. But it comes at a cost to their mental health because we cannot separate ourselves from the emotions that we carry. We can't think our way out of a feeling problem.
But many in law enforcement would say it's the perception of seeking mental health that keeps them from picking up the phone. Now, having counseling separate from a first responder's health insurance and medical history has more feeling comfortable seeking the help they so desperately need.
I think really, in all honesty, I think we've just hit the tip of the iceberg, so to speak, as far as mental health goes. And I think there'll be a lot bigger of a push and everything else going down the road.
Morgan Francis, Queen City News.